Good afternoon, everyone. Welcome to another segment of Family Law Uncorked. I am Jen Bordeaux, the Director of Public Relations with New Direction Family Law. And I have learned on these Facebook Lives that I should not be in a swivel chair because I like to go like this throughout the entire discussion. So I'm going to see if I can sit still this time. So April is a fun time for spring and it's warming up. And even though we're all in our homes, we are also hopefully getting out and enjoying the warmer weather. But April is also extremely important to New Direction Family Law and several others for another very important reason, which is child abuse prevention. April is Child Abuse Prevention Month. And in Wake County, we are very lucky and blessed to have an amazing organization called SAFEchild, which stands for Stop Abuse for Every Child, that we wanted to shed a little light on and discuss just a little bit about SAFEchild, their mission and goals, and how they are adjusting to the public health crisis as well to still be a resource for community members. So I am joined today by three wonderful, lovely ladies. We have Dr. Karen Todd, and we have Elizabeth Clark, and Cristin DeRonja, who is the Executive Director of SAFEchild. So to get us kicked off, Cristin, if you can just speak to SAFEchild as an organization and the wonderful work and goals and mission that you all have for serving families in Wake County.
Well, thank you, Jen, for having us today and being willing to really lift up SAFEchild's mission, but most importantly, the children and families in Wake County. SAFEchild's heart and soul of the mission is embedded in our name. SAFEchild stands for Stop Abuse for Every Child. And we have been fulfilling that mission for 28 years by providing direct services to children and families in the form of parenting classes, mentorship programs that we provide in the home, wonderful program you'll hear about today in the school system called Funny Tummy Feeling, and also you'll hear from one of our medical providers that works at our Advocacy Center.
Thank you so much. Sorry, I have myself muted. We all do. And if we're not talking, just to help eliminate the wonderful background noise that working from home provides. So thank you, Cristin. I appreciate that. And that's at a very high level. SAFEchild does so much in the community. I've been involved for a few years on a couple of different levels, and it's just amazing to such a well-run organization and then the heartfelt work that gets done on a daily basis. So you mentioned or said earlier that we have Dr. Karen Todd with us here, who is a big part of the Advocacy Center. So Dr. Todd, if you don't mind telling us about the SAFEchild Advocacy Center, the work that goes on there and the role that you play.
Sure, thank you so much. I, along with Dr. Betty Whitman, who's our medical director, work with a team of folks at the SAFEchild Advocacy Center to help assess children who may have been victims of abuse or neglect. And so we have several staff members there, folks who work on scheduling and intake of the families and children. We have a family and child advocate who works specifically with the child and their caretaker about whatever needs they may have after the visit, perhaps seeking therapeutic support or guidance for classes, maybe even being referred back to SAFEchild for parenting classes. We have two child interviewers who are trained in forensic interviewing, and they do a private confidential interview with the child that is accessible to the law enforcement who may be involved or to social workers who may be involved. But not something that is shared directly with the caretaker. So we do let the child know that that's part of their medical care in helping them to recover from whatever they've experienced. After their interview, they usually see either Dr. Whitman or myself for a general pediatric physical exam, and that might include taking care of anything from a skin rash that they may have to evaluating any marks or physical abuse that they may have endured, or getting cultures or specimens that we might need to get. We try to do a holistic approach to taking care of that child's health. And so at the end of the visit with us, there's a wrap up and conclusion, and eventually a couple of weeks after the visit is completed, we meet with our multidisciplinary team to make a determination about how that particular case is going to move forward. And that team includes, again, law enforcement, social work, might include the school system, therapeutic support partners in the community, and of course our DA's office for Wake County.
A lot of great things happening there with the Advocacy Center, and either Dr. Todd or Cristin, you guys can, either one of you can speak to this, or both of you. Can you explain the importance of having an Advocacy Center in Wake County? Because not all counties or cities or towns or states, have these advocacy centers. And we recently, had the amazing opportunity to meet Sasha Newlinger and watch his documentary Rewind, and that really shed light for me how important an advocacy center is, because it is separate from the house, the actual SAFEchild house, where some of the programs happen and things. So can either one of you speak to the importance specifically for the child of the advocacy center?
Well, the goal of having a children's advocacy center is to really bring all the treatment and care and intervention that child needs under one roof, and to provide that in a collaborative fashion, so we don't re-traumatize children while we're trying to help them as professionals. And the reality is, when you're trying to understand a child's abuse experiences, different spheres of influence and expertise need to participate in that assessment and that investigation. And we all need the same information, but we don't all need to gather that information independently. We need to be able to be present with the child, have that child not have to tell their story over and over again, preserve that child's experience through a recorded interview in a place and space that is specially designed to be child-focused and child-centered, to be providing those services by professionals that are trained to work with children and understand children's developmental capabilities at different ages and stages. And so working in a collaborative fashion where we are allowed to share that information in order to make the best decisions on behalf of that child and an outcome of the investigation.
Yeah, very well said. Anything you'd like to add, Dr. Todd, or do you think she pretty much nailed it and covered it?
I will say one thing. So many of the children that come to the Advocacy Center will just offhandedly express how much they enjoyed being there. Like, one quote was about what a great little house this is. It feels so warm and welcoming, and aren't you so lucky to come work here every day? And these types of comments are just unprompted, and yet we feel like they're really absorbing and understanding that they're cared for in that environment, and that their needs are being met.
Absolutely. So SAFEchild has several programs that they offer that all can be found on their website, and really focus on the care and education of proper child care for the parents, and just supporting the children and helping them heal and everything, and that whole family dynamic. One very special program is Funny Tummy Feelings. So I'm going to toss it over to Elizabeth Clark. I feel like we're in the Brady Bunch. And she is the director of the program. And so can you just tell everyone a little bit about Funny Tummy Feelings and where all of that stands now? Because I know it has definitely been affected with the public health crisis.
I would love to. Thank you so much for giving us the opportunity. I think that the Advocacy Center is one of this community's biggest gifts in terms of helping children and families heal when the worst can occur in their lives. Our ultimate goal at SAFEchild is we would love for children and families never to have to experience those things. So we do a lot of prevention programs, and Funny Tummy Feelings is one of those prevention programs. So we present to first grade students and we empower them to recognize abuse, to understand what it is, to understand that it's not right, to talk about it if it happens to them, and to protect themselves from it. We give them some strategies for things that they can do when they get an unpleasant funny tummy feeling, which is another term for your emotions, is what we tell the children. We talk about pleasant and unpleasant funny tummy feelings. We talk about secrets, good secrets and not so good secrets, and the differences between the two. We help children understand how to say no, even to an adult. If an adult is asking you to do something that gives you an unpleasant funny tummy feeling, something that you know is not right, or something that could hurt you or someone else. And we help the children figure out who they have in their lives that they can talk to. If they get an unpleasant funny tummy feeling or a not so good secret, or if they do have to say no to someone, and they need to talk about those things, we help them figure out who the people are that they have in their lives. Not in general, not all of you have this type of person, but okay, for this child over here, you have your aunt and your grandmother, and then, another child might have different special people. So the goal is really to empower children to do their best to understand that abuse is not okay. And certainly we teach it in the school system. The Wake County Public School System has made the program part of their first grade curriculum, which is fantastic, and we're thrilled about that. They've been doing that now for 2 years. We also are in private and charter schools in Wake County, and without schools in session, we don't have the program happening now. It did happen before schools were canceled or postponed. A lot of presentations did happen and a lot of children did get empowered. But one thing that has us feeling really great is all of the children in the county that we have empowered over the years, who are now at home and able to put their tools to work that they've been given from SAFEchild. It's really a great thing for us to be able to think about.
Yeah, such a great age appropriate. I mean, I didn't have anything like that growing up,
Right. No, nor did I.
Yeah, it's so important. I think it's so amazing that you guys have worked so hard to get it into all of the schools. So obviously the program's not actively going on, but one of the times that we met, you talked about some expansion of the Funny Tummy Feelings program. Can you speak a little bit to that?
Yeah, so we, in addition to the wonderful partnership that we've built with the public schools and private and charter schools, there certainly are a lot of other youth serving organizations in our community that we could and really should be in, so that we can reach as many children as possible. And we are totally fine and actually big advocates of children hearing this message more than once. So if a child hears it in their first grade classroom and then the next year they are attending a program at a youth serving organization or a camp or something where we are, we're big fans of that. It's certainly, this is not information that is unuseful if they hear it more than once. So the Salvation Army is certainly one incredible organization that continues to serve families even during this public health crisis that we're facing right now. And there are so many other wonderful organizations whose work continues that we are talking with about potentially empowering their children there as well.
That's great. Very exciting things. Infiltrating the community even more. I love it.
That's right. Do it all we can.
So with this, the current time with COVID-19 and the public health crisis and the stay in place, shelter in home, all these different terms for the same thing, right? We're all staying home. Social distancing. One of the unfortunate side effects of all of this is, the increased risk of child abuse and domestic violence in homes. So how is, and probably underreporting because of that as well. So how is SAFEchild still operating? Because obviously it's a resource that you guys, I know, want to make sure is still as available as possible to the community. And to these families. So how are our programs still able to be delivered? How are you guys operating now with the current situation?
You know, SAFEchild thrives in social connections. So when the term social distancing rolled out, we immediately said that is not our strength. But we realized really quickly you don't have to physically be in the same room and be present person to person to be engaged, to be supportive, to provide critical essential guidance to a family in need. So we had to pivot, and we had to pivot quickly. And we had to find different ways to be able to provide our parenting classes and our home-based support, and just any of our outreach also to our community partners at other nonprofits and other professionals through the different technology that's out there. And as a human service organization, that's also not necessarily a real strength as far as technology and having all that equipment. But I am so proud of what our staff has been willing to figure out very swiftly. They've been so open to program adaptation. We've already had one parenting class graduate that finished its final 3 sessions in a virtual platform. We've had several other ones start. We're serving 27 mothers right now through our Welcome Baby program. And we're able to do that through FaceTime and all the different ways to connect, even if it's just a telephone call. So at a minimum, we are having client contact with all families enrolled with SAFEchild once a week. But we are also open to receiving new referrals. Our phones work. We have 2 different phone numbers, 919-743-6140, and then 919-231-5515. We have staff that are ready to respond to those phone calls and help provide resources and support real time to families. So while it may look and feel a little bit different, SAFEchild is still very present, very active, very engaged in making sure children are safe, that their parents are supported. And we realize that not only is stress high really right now, but social isolation is something that contributes to a neglectful and abusive environment. And we want families to feel connected to us so we can prevent children from being harmed.
That's great. And so do you, obviously still being a very active resource for families in the community, and you mentioned the phone numbers, do you have other resources on your website, or can people contact you through your website as well if they're interested or in need of services?
Yes, our program inquiry form is on our website, so parents can go and fill out that form on our website and submit it online. And that is another way to get in touch with us and to get a phone call back from one of our program coordinators. Also, there's a parent resources tab on our website that are parent resources in general of how to be the best parent you can be, but also specifically that have activated in response to our public health crisis.
Okay. Such a good resource just across the board, and unfortunate but necessary, work and programs and offerings that you guys have. So thank you so much for all the hard work that all of you guys do on a daily basis. And I speaking from our firm, even though courts are basically closed, and a new order just came out and pretty much everything's continued out, nothing's going to be heard before June 1st. Emergency custody is one thing that is still being heard. So something that our firm can still actively go to court for and represent someone should the need arise. And we just did a Facebook Live yesterday, actually, with one of the attorneys about emergency custody and what all qualifies under that, and situations of abuse and neglect to definitely fall under that. So, if we can be of a resource to SAFEchild at all, please let us know. We are here. We're fully operational, but virtual as well. All of our numbers are still the same.
Jen, can I jump in and share one more resource?
Of course.
We have found that moms are struggling quite a bit right now, and I'm not saying that dads aren't, but we do specifically have a program called Moms Supporting Moms, and that is a program that meets traditionally on Thursday evenings in person. It's meeting through a virtual platform now. We've just started a second group of that on Tuesday mornings, and we also have a warm line for that program where moms can call in, leave a voicemail, share what it is that they need, what support they're looking for, and that someone will call them back. So that's a specific resource specifically for moms. It doesn't matter how many children they have, whether it's one or more, and it doesn't matter the age of the children, that someone can get involved with right now without waiting.
Great. Thank you for sharing that. Thank you so much. I do know I am a mom to four-legged children, no human children, but I can sometimes they get frustrating or, or I have stressful moments where I feel like I need support. So I can only imagine with real little ones what that's like. So that's a great, great resource. So thank you for mentioning that. Before I wrap us up, because I don't want to take up too much of your time, any final thoughts from either, Dr. Todd or from Elizabeth or Cristin before we close things out?
Yeah, Jen, I wanted to mention, just like we're looking out for our neighbors and friends and the elderly in this time of just sort of unprecedented isolation, I would encourage everyone to be thinking about the families and children in your neighborhood, in your apartment building, maybe people you work with, reaching out saying, how are you managing this? How are you homeschooling and doing a full-time job? Do you need any help? What can I do for you? Because it's so important for people to feel like someone might understand what they're experiencing. And we all know everyone is experiencing this stressor. It's not just one or two or three families. So please check on your neighbors, encourage them to reach out to SAFEchild or to their pediatrician or to a pastor, anyone that they may need for support.
Absolutely. I know you
Can I just say something real quick?
Yeah.
Sorry. I feel too like y'all deserve some props yourself during this time when so few, when people I think do feel like there's less support than they typically have, and there are a few places they can go for assistance. Certainly they can come to SAFEchild and they can come to other community resources. But I think for some of the struggles that you help families with, even though you can't get them immediate answers with the court for some of the things they're facing, I think it's great that you all are still available to help families as you can.
Thank you. I really appreciate that. We're trying, we're doing our best. We're hoping, we always advocate for people if they can come to an agreement and, work things out without having to go to court. That's generally, a better option. So some of this, the silver lining is, prompting people to maybe try to settle issues and resolve issues without having to go to court. So definitely a silver lining there. But otherwise, we're still here for initial consultations to get questions answered for sure, as well as representation and taking on new clients as well. So Thank you for that. I really appreciate it.
Yeah, kudos to y'all.
I think, Dr. Todd, you mentioned, checking on your neighbors and connections, and that made me think of Prevent Child Abuse of North Carolina. Their campaign for Child Abuse Prevention Month is Connections Matter. And I think now more than ever, in general, boilerplate connections definitely matter, whatever capacity. And so now with the, current pandemic and public health crisis, I think that's just even more of a necessity right now. So connections from doing Zoom meetings like this and, getting information out to the community to, checking on your neighbor or your family member, or I've had happy hour meetings with family. I did virtual trivia with some coworkers and friends last week. So people are getting creative, and it does wonders for mental health and mood and establishing some sort of normalcy in this very unnormal time. So definitely lean on those connections, make new connections. It happens. I've heard people going on Zoom dates. So, so that's fun. But ladies, again, thank you so much for joining me. For those watching, please don't hesitate to reach out to SAFEchild if you have any questions, or to New Direction. We're happy to answer those or get you in contact with SAFEchild as always. So please have a wonderful rest of your afternoon. If there's anything that I can do to help you, let me know. Otherwise, we'll see you next time.
Thanks, Jen.
Thanks, Jen.
Absolutely.
Take care.
You too.
Thank you.